Dr. Stephen Schimpf is the former head of infectious diseases, former director, Cancer Center, professor of medicine, and former CEO, University of Maryland Medical Center.
Hello everyone, I'm Steve Schimpf, and this is the second in this series of programs we're doing called Coping with COVID. So today I want to talk about the transmission of this virus. We've heard a little bit about it in the last time, I'm sure you've read about it before, but let's just talk about how this virus transmits around. We need to think about this, that for a person to become infected, they need to get the virus. You can get a lot of virus in a short period of time, like from somebody coughing or sneezing on you, or you can get the virus over a long period of time, much lower levels that are in the air, probably from somebody breathing or talking to you at a distance. So that kind of tells us what we have to do. We've got to avoid that high dose event of the cough and the sneeze, but we also have to avoid the event of a long, prolonged opportunity from someone just breathing, coughing, singing. So let's talk about that some more, but first, in order to get infected, the person is going to but it's going to depend upon their immune system. So if you're older like me, your immune system has gone down. Certainly mine is down from what it was 5 years ago, 10 years ago, 20 years ago. So I don't have quite the same protection I had before. People who have a disease like obesity, diabetes, heart disease, high blood pressure, chronic lung disease, all at greater risk because their immune system is down as well. And then you got to remember people who are getting drugs like the cancer chemotherapy or medications after a kidney transplant. So all these people are at much greater risk of getting infection at the same level of virus coming into their body. What we know about this virus is that mostly it comes from the air. Some of it comes from the table, but we'll come back to that. Most of it comes from the air. And it comes from the air by the things we've talked about, the cough, the sneeze, the breathing, and these are the ways the virus gets to us. But this is what we have to prevent. We got to stop that. A very important point, and it wasn't recognized initially, is that most people with this infection don't have any symptoms at all. They feel fine, but they're walking around spewing out the virus in their breath, in their speech, or if they're singing. So that's a whole different story. Initially, it was always thought that this was mostly spread by that cough or the sneeze, those droplets. But now we know it's also the aerosol that comes just from our mouth. So if you cough, if you sneeze, you know this, those droplets can go a long distance. A sneeze can really throw something a long way. Cough, not so far. So it has to be broken. A mask can help break it. But that's, and social distancing, maybe it can't get that far. So those are droplets, mostly, and they're greater than 5 microns in size. Now, they can float in the air, but they're heavy enough that they'll start to fall down, which is good, but they'll fall on something, like the table. And now I've got my hand on the table, and I can then bring it back up to me. So the CDC, Center for Disease Control and Prevention, now says that they think that only about 8% of infections are due to the inanimate objects. The rest are due to airborne transmission. So we've got to focus on that a lot, but 8% is 8%, so don't forget the touch part. Back to breathing again, and the asymptomatic person. Again, they don't know they're infected. They're not trying to be inappropriate, but just by breathing in and out, they're putting out this aerosol. Aerosol, these are very fine particles, much smaller than 5 microns. So they'll float in the air, they'll float for a long distance, they can go a long distance. Good part is that in sunshine, they'll evaporate fairly quickly. But they can go for a distance, so if there's a lot of it, if I spray it out this way, you can get infected. So just keep that in mind. We've said it before, but the key steps are to wear a mask, social distance, wash your hands regularly, keep out of crowded spaces, keep out of spaces that have low air circulation. Those are sort of the keys. got a little diagram here that shows, let's assume I'm the one who's infected and you are there, not too far from me, and I'm coughing or sneezing. Let's only go right to you. Now, when it gets to your nose, all those hairs in your nose and the mucus in your nose are going to catch those droplets. You might not get infected. You might not. But the aerosol that comes from my talking, that is very fine, and it can go right down into your lungs. That's where you don't want it to get to. But that's what can happen with that fine, fine aerosol. So again, the mask is critical. The social distancing is critical. Avoiding the confined spaces is critical. These will all work as long as we pay close attention to them. I got some pictures here for you. I want to just show this because some people don't, they say, oh, well, the medical folks said don't wear a mask. The politicians said don't wear a mask. Well, that's true, but that was a while ago. Why did they say that? There were two reasons. The first reason was, just like toilet paper, they were concerned that masks would be in very short supply and that hospital workers that are taking care of infected patients wouldn't have enough. And that was the case. There weren't enough. You all heard that on the news regularly. So it was a reasonable thing to say, we shouldn't wear the masks, let the health professionals have them. But there was another reason, and the other reason was that it was really felt that most transmission was due to droplets, the cough, the sneeze. Did not think it was due to just the aerosolization. And it's the aerosols that we now know may be the major culprit coming out of that asymptomatic person. So anyway, here's some of our current medical leaders. Dr. Anthony Fauci of the NIH, our Surgeon General, Jerome Adams, and our Director of the Center for Disease Control and Prevention, Bob Redfield. So they all have their masks on. And then the next one is some of our politicians. And it shows Vice President Joe Biden in a mask, but it also shows, and I really want to make the point here, it shows some really hardcore conservatives that are wearing their masks. Senator Mitch McConnell, former Vice President Dick Cheney, and current Vice President Mike Pence. They're all wearing their mask, all saying that it's important. And they've come out and said this, and it's different than before, but if you've been told in the past or think, oh no, they say it's not important, they do. So stick with that. Let's talk about social distancing for a second. It's pretty straightforward. Keep a distance. 6 feet. What's 6 feet? I always thought that my arm and your arm would probably be about 6 feet. But it turns out that's not correct. My arm's long, but it's not 3 feet. Anyway, here we go. So it needs a little extra. So if I'm going out arm to arm, you may have the distance about like this, but that arms concept is pretty good. These two chairs are 6 feet apart. So if I have a visitor over, I can sit here, visitor can sit here, but not closer. Unfortunately, I've seen lots of people that sit really close to each other, some without a mask on. They said, well, I'm outside. Yes, you're outside, the risk is lower, but if you're close, that aerosol can come right to your friend and you won't know it. Likewise, if you got a visitor over, your very good friend, maybe one of your relatives, your grandkids, they come into your home, you don't know if they're infected because they don't know. They do not know if they're infected. So it's really important that they wear a mask just like you and keep your distance together. So that's it. That's a quick wrap up of where we are today, and we'll pick up again and do some more of these. Thanks.
Dr. Stephen Schimpf is the former head of infectious diseases, former director, Cancer Center, professor of medicine, and former CEO, University of Maryland Medical Center.